So this is the Hair Fall Awareness Month, and let me give you some tips on the hair. So hair fall in scientific terms is known as alopecia, and alopecia can be of three types. One is the telogen effluvium that usually happens due to stress, any nutritional deficiency or thyroid disorders or any long-term illness. Another one is alopecia areata, which is usually autoimmune, meaning by that your body cells are going to kill your own cells. So alopecia areata usually presents as a coin-shaped lesions on the scalp. There are round circular lesions that happen on the scalp in patches of the hair loss, and it is an autoimmune condition. Another one is the androgenetic alopecia, which is usually genetic related or hormone related. So if you have a family history of hair loss, it is usually known as androgenetic alopecia, in which can be male pattern baldness or female pattern baldness. The baldness usually happens in an M-shaped pattern in the frontal area, and these patients may generally land up finally for the hair transplant. So now what are the ways how you can protect your hair in this rainy season? So many patients ask me, Doctor, what is the cause of such bad hair fall in the rainy season? So it is basically the humidity that is there in the environment. So your hair roots tends to absorb a lot of moisture from the air, and they get wet. And also when you wash your hair in the rainy season, the roots get wet and they get swollen, and this swollen roots can easily come out, and then the hair fall increases. So one tip for you in this season is that when you wash your hair, just dry them. Maybe you can use a cold dryer. Never use a hot dryer on the wet hair. Take a cold dryer and dry your hair soon after you take bath, and don't keep them wet, because if the sweat persists on the scalp, again it will cause the swelling of the roots, leading to the severe hair fall. What are the other ways to protect your hair during the season? You can start with some supplements containing biotin, vitamin D and zinc. Half of the Indian population lacks vitamin D in their bones and skin, and hence they suffer a bad hair fall. People know biotin more as of a hair supplement, but mind you, vitamin D is also one supplement which is very necessary for healthy and shiny hair. If you're losing more than 100 hair per day, of course you don't count the number of strands, but you will have a fair idea once you're having an active hair fall. If it is a handful of hair, then you can visit your dermatologist and start a treatment which can be minoxidil or finasteride, which is the FDA approved drug, and it prevents the hair fall. So first you take the medication, and then you can further maybe go for a surgery if it is too much. Along with these biotin and vitamin D, few micronutrients like zinc, selenium and iron, magnesium, these should also be rich in your diet to maintain a healthy and lustrous hair. Now, what are the hair care practices that you can do this season to prevent the hair fall? First of all is, as I mentioned, you have to dry your hair soon after the bath. You don't have to use a very hot dryer and hot styling rods to do your hair. If you can avoid in the rainy season, that will be great, because that can just protect your hair from the hair fall. Also, you can use a mild shampoo and a conditioner. Very harsh shampoos should be avoided during the season. And please be very gentle in combing your hair, in pulling your hair. You don't have to harshly do the combing. Just be very soft in managing your hair, because they are very sensitive in this season. Now, some points for people who have excessive hair fall. What you can do is, first and foremost, you have to visit your nearest dermatologist, take a consult, and understand the cause of your hair fall first to manage it well. You can start with your platelet rich plasma therapy, the PRP therapy. I have made other videos also on this. Platelets are very rich in growth factors, and once they are injected into the scalp, they release rich growth factors to the hair roots, and then hair roots, the growth becomes better. Another method is the low level light therapy, which is known as LLLT therapy. There is a cap kind of a thing which is put on your scalp, and it releases LED light, the specific light to grow your hair. And then that is also one stimulant for the hair root to grow better. And the final method to protect your hair is the hair transplant. If you are a case of androgenetic alopecia and you have had a severe hair loss, then you can visit your dermatologist or plastic surgeon to go for a final surgery, which is known as follicular unit extraction or the hair transplant. Thank you.